Hi, I'm Vish Narayan. I'm the Executive Chairman of TruDoc Healthcare. So TruDoc Group started in the UAE about 12 years ago. It is a digital health company. It's the leading digital health company in the UAE and in the region. And what TruDoc does is provide digitally enabled primary health care. So anytime anyone falls ill, whether it's an acute illness, you have fever or a rash or something like that, or if you have a chronic condition like diabetes, hypertension, TruDoc's doctors and a team of doctors that we have here in the office are available 24/7 that can treat you. So you can just call through the phone, through an app, either it's audio or video. We'll be able to treat you digitally in the comfort of your own home. So TruDoc essentially, before we acquired Wealthy, was managing a lot of what is called as acute patients. And acute patients are patients that have an episodic illness. So it could be a fever, it could be something which is for a short period of time. Chronic illnesses are illnesses like diabetes, which you have for a long period of time or for the rest of your life. Right? Wealthy, which is the leading provider of digital health solutions in India and other parts, is a chronic care management solution. So they help you manage your chronic conditions better. So TruDoc's competence or TruDoc's capabilities to manage acute illnesses, to manage your doctor consultations, etc., complemented with Wealthy's capabilities of managing chronic conditions, together then complete the whole picture. The chronic side of the patient experience is a very important side. Roughly 25% of patients here in the UAE have a chronic condition. 35% of patients or people in Saudi Arabia have a chronic condition. So managing chronic patients is a very important aspect, not only for insurance companies, but for the DHA or for regulators, because it's an expensive thing for a country to have a very large number of chronic patients. So the acquisition of Wealthy allows us to bring in capabilities which nobody else has in this region. Nobody else has the technology capabilities that Wealthy brings to manage chronic conditions better. When you're sick, you always long for familiar surroundings. Right? So you'd rather be with your loved ones, you'd rather be eating the food that you're comfortable with, you'd rather be close to the book that you want or your favorite Netflix show, right? And whether we like it or not, a hospital, for a variety of reasons, has to be managed in a situation where everything is sterile, there's infection control, there's a certain lack of warmth that comes when you're in a hospital. So every patient actually wants to be treated at home if you can. Right? Not every condition can be treated at home. So we obviously cherry pick the conditions that can be treated. And orthopedic is a big area where a lot of these things can be treated at home, whether if you're recovering from a stroke, for example. A lot of the times the stroke patients have to do physical exercise to exercise your limbs or arms. A lot of these things can be done at home because the physio can come home and help you do this. Increasingly, a large number of conditions can be treated at home, and not every condition can be treated, and not every home is capable of providing the infrastructure that is needed. But I think as we look at the next 10-15 years, more and more conditions will be treated at home, because eventually that's a better solution. It's better for the patient and it's cheaper to do this at home. Everywhere around the world, whether it's India, Southeast Asia, China, US, but we don't have a large digital health company here in the Middle East. And I believe that is the way forward. That is the way healthcare should be delivered efficiently as well as in a convenient fashion to all the citizens. So when I moved here, I realized that Dubai was lacking and behind in the adoption of digital healthcare services. And we want to build the next digital health unicorn coming out of the Middle East.